you guys, I hope you all are doing great. So today is International Day of Persons with Disability, and I'm sure we all know how much physiotherapy helps an individual to overcome their physical disability, but it is also equally effective for the ones going through other disabilities as well. So, the theme 2020 of World's Disability Day is a day for all. That is, it reflects a growing understanding that disability is a part of the human condition. And this day also gives us the perfect opportunity to further our knowledge and awareness about the disability. So now, today we are going to talk about it. So, what is disability? Any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being resulting from impairment is known as disability. For example, difficulty in walking after the amputation of one leg. So this is the disability, that the person is not able to walk properly. And now we come to the types of disability. There are two types of disability. First is primary and second is secondary. So primary disability is direct consequence of a disease or a condition. For example, that inability to walk due to hip fracture. When there is a hip fracture or fracture in the tibia or fracture in the ankle, then there is always a problem in walking. When it comes to the secondary disability, it is indirectly related to the disease or the condition that is responsible for the primary disability. So, disability further can be broken down into number of broad subcategories, which include the 8 main types, and these are mobility or the physical, second, the spinal cord, third, head injuries, fourth, vision, fifth, hearing, sixth, learning, seventh, psychological, and eighth is invisible. And now we come to the important part, and that is the physiotherapy. So physiotherapy plays a vital role in preventing, reducing the health and health related problems, and this is because the physical therapist knows the disability. Physiotherapy is ideal for supporting the people with disabilities to participate in the physical activities. There are plenty of ways by which the physical therapist helps an individual who is facing the disabilities. Moving on to the ways, and there are n number of ways, and it is according to the physiotherapist and according to that person facing the disability. So naming few of them, firstly the physical assessment, which is very important at how someone moves and walk and talk, and the patient is evaluated as a human being and not as a case. Secondly, prescribing the mobility equipment to walk, stand, move, and those equipments are frames, crutches, sticks, wheelchairs, etc. ADL training. This is very important just because the full form of ADL is activities of daily living, and along with these, various therapeutic modalities such as hot and cold, which are helpful in relieving the pain, are also prescribed. Next, we jump on to the balance training, gait training, and usage of the prosthesis if needed, and the usage of prosthesis is usually comes under the amputation. Next, we tell the caregivers about the home modifications and the precautions which they have to take care about when the patient is grooming and bathing and dressing, undressing. All these are very important just because they have to take care of their health, as well as they have to take care that they should not get hurt by any means. Guys, before I end this video, I wanted to say, while I did use the word disability, and that is just for me to explain you guys the concept in a better way, but we should never use the word disability for anybody, because each and every one is special and we are all equal. And on that note, thank you so much for sticking with me throughout this video, and I hope you guys had a great week ahead.